I'm Jaroszewski, the Director of the Thoracic Surgery and Chest Wall Program here at Mayo Clinic in Arizona. Thank you for considering Arizona for your pectus surgery. What makes us special? We are the largest center in the U.S. for patients 16 and older, performing over 300 pectus-related cases every year. Many of our patients are in their 30s and 40s, when correcting the deformity is much more complex. We perform more repairs on older patients than anyone in the country. As a thoracic surgeon, my practice is pectus. This is my specialty niche. As a dedicated team with over 2 decades innovating, we have become leaders in minimally invasive pectus surgery. Our procedure includes changes to the standard NUS performed in children. You will receive the latest methods of pain control, including cryoablation and medications. Patients deserve a minimally invasive technique that's safe, effective, and life-changing. No patient is alike, and subtle differences in performing surgery can make the difference between good and excellent. Our goal is to achieve the best outcomes for you, restoring the ability for your heart and lungs to work normally, as well as a chest that looks good.
Most patients traveling here for surgery are coming from all over the United States and around the world. Once you have a surgery date scheduled, you can start planning for the time you'll be here in Arizona, around 7 to 10 days in Phoenix. We recommend that any reservations you make are changeable or refundable due to unforeseen circumstances.
So a day or two before surgery, you will meet with one of our advanced practitioners and be given specific instructions for surgery. You will also have additional testing at that time to make sure that you can safely be administered anesthesia for your surgery.
At Mayo Clinic, we work closely with our cardiology colleagues, not only before surgery with your testing, but also during your repair. The cardiologist will be there during the surgery using a transesophageal echo to confirm there's no remaining compression on the heart. We feel this is critical to ensure the procedure is done safely and correctly. During your initial consultation, we discuss many details of surgery. I will briefly review some of the surgery specifics here. We use 2 small incisions on each side of the chest to place the bars under the pec muscles. It's the same whether you get 2 bars or 4. There's also a small incision on the lower right side of the rib cage where we place the camera to be able to see inside the chest. Getting across the chest on the inside can be difficult when the pectus is caved deeply inward. For safety, we use what is called forced sternal elevation. The clamp is placed onto the sternal bone and attached to a crane-like retractor, so your chest can be lifted up and there's space between the heart and sternum. Lifting the sternum improves the ability to see across the chest and makes it safer to do the procedure. We use multiple bars to correct defects. Just like a sagging roof, you want several beams to support it. Multiple bars distribute the weight and pressure of the chest wall, and studies have shown it to be less painful after surgery as each bar has less pressure on it. These bars are placed between the ribs and go under the sternum in the middle. We get a more evenly lifted chest using multiple bars, and also hammock stitches, which encircle the rib spaces where the bar will sit. We pride ourselves on having a bar migration rate less than 1%. Multiple steps are used for keeping bars stable. These include tying bars to the ribs and sternum with a suture called fiber wire, which is a braided polyester string that's not actually wire, it's just strong as wire. We then use connectors that link and lock the bars together.
After surgery, you will go to the post-anesthesia care unit, or PACU. They will closely monitor you as you wake up from anesthesia. Most patients do not have a significant amount of pain, but do feel tightness and pressure on their chest. Your bars will be pushing and holding the chest out, but the chest wants to go back to the position it has been in for many years. Our team will work to make sure you are stable, comfortable, and the pain is well controlled. Once fully awake and doing well, you will be moved to your hospital room. All patients will have monitors for their heart, breathing, and oxygen levels to monitor how you're doing. You may have company stay with you overnight as well.
Most patients stay 1 night in the hospital. When you are discharged, You will have full postoperative instructions and medications. It's important to have someone accompany you to Mayo Clinic, as you will need help with your postoperative care. You will not be able to drive after surgery or if you are prescribed narcotics. You will also be limited in what you are able to pick up, push or pull, and will also need someone helping you with medications and instructions.
After discharge, patients are generally scheduled a post-op visit within a few days to a week. During that visit, we will be looking at your chest x-ray, assessing how your incisions are healing, and other information. Once you return home, we can work together by portal message, phone, or with your PCP. Generally, the schedule for x-rays is 6 weeks and 6 months after surgery, and you will be sending those films to us. You are not required, but always welcome, to return to Mayo Clinic for follow-up up until time of bar removal. It is essential that you have a primary care doctor that is well informed and can help take care of you. They need to know you are having surgery, what is expected for your recovery, and will be important should you need additional care. All your records will be available through your portal. Some patients may need to take medications longer than what we prescribed, and your PCP is important to help in getting more medications, such as narcotics, which we cannot refill across state lines. We are here to guide you through each step to make sure you feel prepared and confident. Every patient is concerned about pain after surgery, and everyone is different as to how much pain they feel. Our goal is to help keep your pain levels low, so we use polypharmacy, which is a combination of medications that work together in different ways. Examples are ibuprofen, Tylenol, muscle relaxers, etc. This lessens the need for addictive medications, such as opioids or narcotics. You will be started on medications for nerve pain 2 weeks before surgery. The initial dose will be very low, and it is continually increased until the time of surgery. During surgery, local anesthetic will help block the pain, and cryoablation freezes the nerves of the chest. The effects of cryo wear off around 4 to 6 weeks.
After your surgery, we want you to be up, walking, and doing as much as you feel able to. Most patients can easily walk, go up and down stairs, and their activity is not significantly limited. Patients can lift their arms, bend over, turn from side to side, without worrying that it'll affect their surgery. However, we do restrict the amount of weight you can lift, push, and pull to less than 10 pounds to promote chest muscles healing around the bars. After 4 to 6 weeks, your muscles should be mostly healed, and once I review your chest x-ray, we will let you start doing more. That does not include heavy lifting with the chest and arm muscles, things like full body push-ups or planking until I review your 6-month x-ray. If everything looks good at 6 months, you can start unrestricted lifting. Just listen to what your body is telling you.
And even though I'd had my chest deformity obviously since birth, I never realized that it was anything to be concerned about until my 30s. I do feel that Mayo understood my condition better than anywhere else before. While I didn't ever consider surgery prior to Mayo, I would say that the care that I was offered previously was not looking through the lens of Pectus. So, as I mentioned before, I'd had many echoes done that said that my heart function was great. I'd had many chest x-rays that said that there was nothing going on in my lungs. There was nothing that could be seen, nothing that could be changed, no reason for why I was still so sick. And it wasn't until seeing care here at Mayo Clinic that the radiologist pointed out on my x-ray, this patient has Pectus Excavatum. And then that led me to my initial consult with Dr. Jade. And once all of those pre-testing requirements were done, meeting with Dr. J really highlighted everything that I had been feeling caused by the Pectus. So everybody is there to help you, everybody has your best interest at heart, and everybody wants to take care of you. And I think that's the impact that everyone's seeking when they're looking for care. And I haven't found that anywhere else but here.
I look forward to seeing you soon and repairing your Pectus. Surgery will be the next step towards your new future.